Thank you all so much for being here. This is our third installment of our Lunchtime Learning webinar series. My name is Leah Raffa. I am with the Substance Use Prevention Program here at Denver Public Schools. Specifically, I help coordinate a grant that allows us to provide curriculum and training to schools within DPS. If you have any questions about our program, I will put my email in the chat. Additionally, if you have any questions about this webinar, we will have time at the end to address all of those questions. So please enter any of your questions in the question and answer section. And so with all of that housekeeping taken care of, I am so excited to introduce our speaker today. I saw him speak a million years ago back when I was an intern, and I was blown away by his presentation. He is the Director of Service of Behavioral Health Services at Denver Health and a Professor of Psychiatry at the University of Colorado, Denver, where he conducts research on youth substance use and addiction, and has served as Director of Medical Training for the university's Addiction Psychiatry Fellowship Program. He is one of about 4 dozen physicians in the United States who are board certified in general, child, and adolescent and addiction psychiatry. Also, in October of 2012, the White House Office of National Drug Control Policy honored his work by naming him an advocate for action for his efforts nationwide to address drug use and its consequences. I am so excited to present Dr. Christian Thurstone. Dr. Thurstone, thank you for being here. I'm going to turn it over to you.
That's great. Leah, thank you so much for that introduction. And Julie and Leah and everybody who helped organize this. This is great. And thank you for coming to join today. And someday we'll be back doing these things in person. But this is really nice to see everybody on the participant list here. I see there are some people on the participant list who know a ton about this. So it makes me a little bit nervous at the same time. But my plan is to just be kind of a warmer-upper here to talk for about 30 minutes or so, and then to hopefully people will be very chatty and have a lot of questions and comments and concerns, and we can chat away. I'm trying to monitor the chat function, and I know somebody's monitoring the Q&A function and the raising hand function, and so feel free to use those different methods to help make this interactive, and so it's not anything like death by PowerPoint. So with that, I do have some slides, and I'm happy to share these slides. And so Leah, I can email these to you. I see your email there, and Julie, and then you can dispense them as you see fit. So let me go ahead and share my screen here, and this will help keep me on target. All right, and now I need to get my chat function fixed here. All right, and my Q&A function. All right, so we're good to go. I have myself situated. This chat function makes me feel like I'm passing notes in classes. All right. And how can you tell if your child is using substances? It's really hard to know. So thank you for that question. And I'll try to make sure I answer that, or at least speak to some of that the best of my ability as we go on here. So parents, teen brain, substance use, mental health. So had to start with a little bit of levity here. Someday when our prefrontal cortices are fully developed, we'll look back on this and shake our heads. So the prefrontal cortex is the part of the brain up here in front that is not fully developed in adolescence. And that is the part of the brain that helps us think ahead, plan ahead, know that something is not a great idea and stop us from doing it. So we will talk more about that in a little bit of detail. First, I wanted to give everybody a chance to get a little bit centered here. This is an exercise we do a lot in treatment and prevention work that we do here at Denver Health. and it's connecting people with really what matters to them. So Dr. Frankl is a very famous psychiatrist who survived a Nazi Germany concentration camp and then went on to write some books and give a lot of lectures on resilience. And he's very famous for saying that people who have a why can tolerate any how. So this is just something to center us and connect us to what we want to focus on today. So if you want, go ahead and I'm going to look at the participants also here. See if you can figure out how to raise your hand in the raising hand function to the values that you want to focus on today. So first one is authenticity. Second, yeah, thank you for the hand raising here. And let's see if I can figure out how to raise my own hand. I don't know, I might mess something up for everybody if I do that. So I'll just do it the old-fashioned way. Adventure. Autonomy. Balance. Beauty. Compassion. Nice. Challenge. Nice. Citizenship. Competency. Contribution. Fairness. Trustworthiness. Friendships. Ooh, that sounds like a good one to focus on today. Really, we can choose what matters to us the way we choose our favorite flavors of ice cream. Fun. That sounds like a good one to focus on. I think we can all use a little fun. Growth. Happiness. Honesty. Inner harmony. Kindness. That's a big one I'm trying to focus on today. Yeah, that's a popular one. Knowledge. Loyalty. Meaningful work. Peace. Recognition. Respect. Security. Self-respect. Spirituality. Wealth. And wisdom. So that's a lot of what we do in our adolescent substance treatment, is connecting families and adolescents with who and what matters to them. All right, so a little bit about the developing brain that I wanted to share. So we used to think that the brain was fully developed by about age 6, and then not much happened after that. Now we know that the brain is developing tremendously in the adolescent years. So this is a fMRI picture of the brain as it develops from age 5 on the left to age 20 on the right. And blue parts of the brain are parts of the brain that are mature. And so you see that the brain really does a lot of maturing in adolescence, number one. Number two is that the brain matures from the back forward. So this is the back forward, and it matures from the bottom up. So you can see here from this pictures, what's one of the last things to mature is this prefrontal cortex, which is right in this area here. And that's exactly what my cartoon showed, helps us think ahead, plan ahead, things like that. So that's one reason why adolescence is a very tricky time. They frequently do things that they know are not great ideas, and yet it's hard for their brain to say no to that. So you can see that an adolescent or a little child is a little bit protected. They don't really have great judgment or impulse control, but at the same time, the part of their brain right about here that is the brain reward circuit is not fully developed yet. So they're a little bit protected. Adults are also a little bit protected. Their brain reward circuit is developed, so they want to go do things that might not be a great idea. But at the same time, the front part of their brain that can say no or be the brakes is developed. And so that's a lot of the trickiness with adolescents, is that they're in this in-between stage where they have the desire to do things that might be risky or not such a great idea, to seek ways to seek pleasure and fun and adventure. And the front part of their brain has a hard time saying no to that. And that's a lot of the complexity with adolescent substance use, because all substances of abuse work through this brain reward pathway right here, all of them. So whether it's nicotine, alcohol, opioids, marijuana, they all do the same thing there. They increase the amount of dopamine in that part of the brain. So let's see here. Maybe I'll move to the next slide here. And so this is a different picture of the brain here. And this is this brain reward circuit I was telling you about. All substances of abuse increase the amount of dopamine in this structure right here in the brain reward pathway. That was probably originally designed to respond to food and sex, and then it just so happens that all drugs of abuse can hijack that area of the brain. Some important brain structures also here, for example, so emotions are right here. There's a structure right here called the hippocampus, which is really important for learning and memory. This is the back part of the brain that's really important for balance, coordination. And this is this famous prefrontal cortex that helps us think ahead and plan ahead. And you see, this happens to be a slide showing all the places in the brain where marijuana binds to. They're called cannabinoid 1 receptors in this case. And you see there are a lot of these receptors in the prefrontal cortex, emotion centers of the brain, pleasure centers of the brain, in the learning and memory parts of the brain. That's a real concern about marijuana use among adolescents. And then the back part of the brain that helps control balance and coordination, which is really important for things like, for example, driving, and why driving under the influence of pretty much any substance is not a good idea. So that's a little bit about brain science. Brain science with adolescents, again, this is fully developed in adolescence, so they have the desire to go do risky things and seek rewards and pleasures and adventure. And yet, sorry about that, this part of the brain right here that can say no has a hard time saying no because it's not fully developed yet. And so that's why adolescents are vulnerable to addiction and substance use and other risky behaviors. And this is also, if we want to flip it to the good side of things, this is why adolescence is such a great time. Adolescents can be very brave and creative, and there's a reason why people tend to do their genius work in their late adolescence, early adulthood, because this also helps them think outside the box. It's why adolescents, young adults can be very brave in the military and in other ways of life. So this is a little analogy I have here. So this is my foot in my Toyota here. And so in adolescence, the gas pedal here on the bottom works great, is nice and big there, and the brakes are much smaller in adolescence. So the transition to adulthood goes to a time when the gas pedal and the brake are more balanced. So another thing that's really important in adolescence is that a part of their brain called the amygdala, deep in the brain, which helps us process emotions, is developing. So you may have heard adolescents say, so-and-so was so mad at me. When we're like, really, they were mad? I thought they were just, kind of speaking their mind a little bit. Well, this explains some of this here, that the fear that most adults see here is being frightened, is the emotion that most adults see in this person's face. Whereas 50% of adolescent boys will see the emotion of anger in this face. So literally adolescents and adults are not seeing the same thing here. Yeah, good. I like the chat here, and I look forward to getting to this all here. All right, great. So I wanted to share something here. So very famous psychologist in the 1950s made a really fascinating, important discovery that I'm going to touch on in some more detail in a bit. But what Dr. Harlow did was that he had monkeys and he would feed them through this wire monkey here. And then he would, what he found was, even though the monkeys, baby monkeys, got food here, they preferred to hang out with this soft image of a monkey here. And that really opened the way to attachment. That attachment to one's caregivers is about a lot more than just food and shelter and things like that. It's about having a really strong emotional attachment that we'll talk about in a little bit. So that then led the way to Dr. Bowlby and Mary Ainsworth, who did a lot of research in human attachment and coming up with the different types of attachment that people may see. And if people want to be able to see the chat function, there should be down at the bottom a way to click on chat and Q&A. We'll talk about that more, and I'll read them out loud. And there are three main types: secure, insecure, anxious, and insecure avoidant. So secure, the child knows that the caregiver is there for them and will be available and responsive. We'll talk more about that in some detail. Anxious is, well, sometimes the caregiver is there, sometimes not. So that can create some anxiety. And then if caregivers consistently have difficulty being available, then that can lead to an avoidant style of attachment. Would it be fair to say teens not only have desire, but also developmental need, norm of seeking new experiences? And that is how they learn, socialize, and develop identity. Thank you for the great question there. And going back a couple slides, and it's been said that a child's job is to play and to experience and have different experiences and figure out who they are. And it's been very clear in this attachment literature that children who have a secure attachment feel safe going out and exploring their worlds. So that's a very relevant question. Thank you for that. So coming back to substance use here, we have past month prevalence of marijuana use by age. So you can see this really peaks in the peak occurs right here at 16, 17, 18, 19, 20, and then starts going down after that. So this is a slide specific to marijuana. It's highly similar with respect to alcohol as well. So there's something about, again, adolescence and substance use, which is dangerous. On the one hand, youth are experimenting and trying new things. On the other hand, they have a developing brain that's much more susceptible to addiction. And for every year we delay the onset of substance use, we strongly reduce the chances of somebody developing an addiction. All right. And unfortunately, as I'm going to go through in the next few slides here, I think that some of the alcohol, marijuana, tobacco companies know this. So they produce products that can appeal to young people. So say, for example, here's a vaporizer for marijuana. These are marijuana edibles that, are brightly colored, sweetly flavored, things like that. Fortunately, we've made some wonderful progress. Like we have gummy squares and not gummy bears anymore because this was too appealing to young people. And then when it comes to the advertising, you have some cartoon advertising with Santa Claus and coupon advertising that we know disproportionately appeals to young people. But it's not just marijuana, it's, juuling has been a really significant problem recently. So these are nicotine flavored or nicotine vaporizers. And it looks kind of like a USB port here. And they're trying to crack down on this, although it still is available. It comes in different flavors, like this is mango here. And so that's been shown to disproportionately affect young people. And then we know that alcohol advertising is pretty ubiquitous. And so now kids don't look until you're 21. And so that's a problem as well. Okay, great. I see the chat function is open now. Okay, so let's see here. I was going to go through marijuana and its impact on development, tobacco, its impact on development, and then alcohol. And I'll have to do this briefly here. I'll take just maybe 5 more minutes of me talking, and then we'll open it up for comments, questions, concerns. So let's see here. 1 in 6 youth who try marijuana develop an addiction. Heavy use starting in adolescence predicts up to an 8-point drop in IQ from age 13 to 18 if it continues as heavy use. This is a very strong story here. This connection between adolescent marijuana use and psychosis in adulthood keeps getting repeated with more and more studies, and there's strong concern out there about the highly potent marijuana that is especially predictive of psychosis, developing psychosis with marijuana use. What is psychosis? It's basically a break with reality, hearing things, seeing things that aren't there, paranoia, things like that. That is a significant concern that I've had a lot of families have a lot of distress about, and they had said, I just wish somebody had told me about this connection between marijuana use and psychosis. Marijuana and development. Marijuana is strongly associated with decreased school achievement, even if it's using once a week. So even what we would call casual use. I'm going to skip ahead here. Nicotine. I want to just go through a vaping cartridge here. So basically, there's a mouthpiece. This is where the juice, the nicotine juice is stored and can come in different flavors. And then this is the part of it here that heats it up and vaporizes it, a button and a battery. So this is a little vaping machine here. It's better than smoking in terms of the lungs, still terrible in terms of brain development. And still, there were some very famous cases, about a year ago of people having some very severe lung effects from this too. So not safe and definitely not recommended for adolescents. Nicotine also has a significant impact on development. Just in the interest of time, I'll highlight the last point here. Nicotine exposure in adolescence predicts anxiety, depression, attention problems, impulsivity in adulthood. So it also, we know, has an effect on brain development. And we definitely know that 90% of smokers, adult smokers, start before the age of 18. So that's where Leah and Michelle Holian and all of other prevention specialists, why your job is so very crucial and important. Alcohol in development, we also know, is not good for brain development. And it's kind of interesting. I've been saying the adolescent brain is different than the adult brain. It's a different brain. And the adolescent brain responds differently to alcohol than the adult brain. They are less susceptible, adolescents are less susceptible to the motor and sedative effects of alcohol than adults, which is really fascinating because that enables adolescents to do more binge drinking, unfortunately, if they're less susceptible to the motor effects. And then the hippocampus of animals exposed to alcohol as adolescents tends to be smaller. So it looks like it's toxic for brain development in the part of the brain that's really important for learning and memory. And thank you for the questions. I'll make sure I get to them. A warm relationship between child and caregiver is the strongest prevention and treatment that we know of. That's one reason I went into that earlier with Dr. Harlow. How to promote attachment and bonding. We do a lot of this in treatment and also in prevention work, helping parents to be accessible, so spending time with each other, helping parents, caregivers have responsiveness. So that's the ability to interact on an emotional level, to read a child's emotions and adolescent's emotions and acknowledge them. And then engaged, knowing someone is attracted by, absorbed by, and values you. So I think we may have the experience of that with our friends or with our romantic partners, somebody who's just really attracted by you, absorbed by you, values you. That's what engagement is. And that happens also between caregivers and children, adolescents. So the acronym is R, accessible, responsive, engaged. I'm just going to go through, one thing that prevents accessibility these days a lot is cell phone use. So here's a measure of dependence on cell phone use. Testing responsiveness here. So again, ability to respond emotionally to one's child. So just to test our own, if the chat function is open here, you can chat. Like what emotion do you see here, for example? For me, I might say that looks like disgust. No, maybe I would say contempt. What emotion do you see here? Snarky, skepticism, unsure. Yeah, definitely. What emotion do you see here? Yeah, I could see surprise maybe in this one. Could be fear. See, I need to practice this. Surprise, yeah, so people think, yeah, surprise and fear. So again, just trying to be emotionally responsive to our children is really important for developing that connection, because again, that's what we want with our friends as well as our partners. This one, engaged here, this is an item, this is a questionnaire on how much we feel valued and close to people. So others often are reluctant to get as close as I would like. I often worry that my partner doesn't really love me. I rarely worry about my partners leaving me. So this is for adults here, but if you think about it, this applies to the concepts apply to our relationship with our kids as well. Kids, students, and that connection. How committed and engaged are they with me? So with that, I'll finish up here. Further resources, I have a website. Feel free to reach out to me. It has my email on there. I try to keep it updated with good information. And then there's a book I wrote, Everything I Wanted Parents to Know About or Caregivers to Know About, Adults to Know About with respect to substance use. And with that, I'll just stop sharing here and we'll get into some of the chat that people have and the questions. Is that all right with you, Leah and Julie, if I get into some of these things I see in the chat and the Q&A?
That's perfect. Do you prefer if we read off the questions or would you like to? Perfect. Sounds good.
What would you prefer, Leah?
Whatever is easiest for you.
Why don't I start reading them, and then if I'm missing something, then you interrupt me and tell me I'm missing something. How's that sound?
That sounds great. Thank you.
Awesome. All right, so I see a few things here. How can you tell if your child is using substances? It's really hard to know. First, again, I love the, right here is a perfect example of a caregiver wanting to be responsive to their adolescent and to read what's happening. So I just want to first validate that is awesome. That's exactly part of the connecting attachment process. Then the second thing about that, how can I tell if they're actually using? I mean, there are checklists around this. Basically, I think they're summarized with, is there some kind of change that's happening recently that's perhaps especially a change for the worse? So a decrease in school functioning, a change in relationships, an increase in irritability, an increase in social isolation. Those are all things that could be sign that something is happening in terms of mental health or substance use, and that would warrant going into more detail around that. I think some other signs would be, one thing that's definitely associated with preventing substance use is parental involvement. So again, that's the accessibility in a child's life. And the more involved parents, caregivers are, more frequently they'll find some of those marijuana products I showed, some of those vaping products that I showed. And I encourage people to deal with things early. It's so much easier to treat cannabis use disorder mild compared to opioid use disorder severe. So I'm a big fan of earlier intervention is better. Same thing as cancer, much easier to treat stage 1 cancer than it is stage 4 cancer. Many young people and adults too with ADHD, depression, anxiety tend to self-medicate with marijuana. How do you determine which is which? Marijuana the cause or marijuana or mental health the cause of the use? That is such a great question. Thank you for that. Please keep it coming. Short answer is we can't exactly know. A longer answer is that the study has actually been done to where people have both mental health and substance problems. And if we treat the mental health alone without treating the substance issue, the mental health issue will get better. The substance issue will not get better. So once there's both mental health and substance issues, we have to treat them both in a coordinated, integrated fashion. It is the current standard of care. We definitely know that people with ADHD have higher risk of developing substance use disorders. We know that about 30% of adolescents in substance treatment have depression. 30% have anxiety, 30 to 50% have ADHD. It's very common in adolescent substance treatment, and we need to treat both mental health and substance. And another great question, causation versus correlation of susceptibility to psychosis. Short answer is, I don't know if we're ever going to know, because we can't do the study ethically in humans. Now, we can do this study in animals, to where we expose adolescent animals to different substances and then see what happens. And those were the data I was citing around nicotine and alcohol impact on the developing brain, to where nicotine seems to produce more adult anxiety, difficulty with attention and impulsivity in adulthood, and alcohol can damage the part of the brain that's important for learning and memory. Now with psychosis, it's just difficult to have an animal model for that, so stay tuned. Having said that, there's much cause for concern, just given how many times this finding has been repeated. Since 1989, the first paper came out on that study of over 45,000 Swedish soldiers, and they found that adolescent marijuana use predicted later on developing schizophrenia, and it's been repeated multiple times. So I'm really concerned about that one. Let's see here. And then, do you think that time families are having together because of COVID will promote healthy attachment bonding, or potentially have negative outcomes? And do you think that we will see any shifts in data regarding substance use in a positive direction because of it? It's interesting to think about potential opposite shifts could then come from everyone going back to school and work in the future. What another great question this is. So I'll tell you what I do know. So opioid overdoses are going up in the state during COVID. So we know that that is happening. We know that alcohol sales are up. We know that marijuana sales are up during COVID. We do not know if adolescent substance use is up, though. We don't know that. We also don't know if adolescent suicide is up during COVID. So it's an interesting hypothesis. For some families, you could see that this COVID isolation could promote more attachment and bonding with the families and having some really tender moments together. And on the other hand, we do know that pandemics and natural disasters are associated with increased domestic violence and child abuse. So I would say it can go both ways on this one here. It's a great question, and I think time will tell us. All right, let's see here. All right, I'll try to get to both the chat and the questions here. What specific ways can school mental health providers support with interventions with teen addiction? That's such a great question again. So let's see here, can support with interventions with teen addiction. Like I mentioned, getting treatment early as opposed to late is always a good thing. So early identification, referral of some kind of problem if a kid is struggling. Other things, one of the backbones of adolescent substance treatment is something called motivational interviewing. And I actually have a book right here in my cabinet on motivational interviewing for teachers. And so teachers are getting trained in motivational interviewing, and it's a really brief, wonderful, powerful intervention for adolescent substance use. So that's one of the first things that comes to mind. Another thing too that comes to mind is that a really strong protective factor for adolescent substance use is connection to school and school engagement. So anything that keeps kids connected to positive things like school and sports and pro-social activities, we call them, is a great thing. So I think that's good. I feel that I follow ARE well, but my 16-year-old does not want to engage with me that often. He loves me, but is annoyed by my R. I think that's a great question also. So here's what I have to say about that. And I have teenagers too. So I experience the pain of this as well as understand this in my head too. So let's see here. I think the bottom line there is that teenagers act like they don't care. It feels like our teenagers don't care what we think and what we feel. On the other hand, I think they deep down somewhere in a way that they don't verbalize, or they verbalize in a way that's a little bit funny, they do tremendously care what their adult caregivers think and feel, and that relationship matters more than ever. And as adolescents become more and more independent, the main influence that adults have is that relationship. So I would encourage you to hang in there and keep doing your best. And the ARE changes over time. In some ways, you know, when it was a baby, it was easier, and it gets more complex and tricky as adolescents. What public policies should the federal government, state lawmakers, and local governments pursue to address youth substance use? Boy, that's a great point. So, you know, they say that youth substance use is made up by access to the substance, how easily accessible it is, social norms around the substance. So is it normal and accepted to use the substance, and then also perceived harmfulness of the substance. Had a patient move here from Ohio, saw him yesterday, and he said that, wow, marijuana is so much more available and potent here. And so that was just an example of accessibility. So I think there's that. I think that making treatment more available, getting into school-based health centers and school settings. We know that prevention, evidence-based prevention practices work. And so we could invest in multiple layers, I think, on this. Anything that decreases access, that changes social norms, that improves or increases perceived harmfulness, makes prevention programming more accessible, makes treatment more accessible, is 2 thumbs up. A lot of work being done now, is my understanding, on potency limits regarding marijuana. I think that would be a good thing for reducing marijuana addiction, and especially psychosis is what I'm really worried about. Considering the epidemic of teens using vape products, and specifically the increased nicotine content in vape devices such as Juul, in addition, the marijuana that is available today has huge THC content. Which do you feel is worse for the developing brain? In your practice, do you treat more marijuana addiction or nicotine? So marijuana is what brings 95% of youth to substance treatment in the Denver area. Nationally, it's 2/3 of adolescents in substance treatment come from marijuana use. And then of the teens in substance treatment, 2/3 have nicotine addiction. And so they're both bad for the developing brain, I think. And we try to treat all substances, and the prevention literature that I've read shows that we should be trying to prevent all substance use, focused on all of them. These are great questions, and I'm happy to keep going. I just want to pause. Julie and Leah, am I doing an okay job? Do you want me to do something differently or the same?
This is perfect. Thank you.
All right, cool. I'll keep going then. And we go till 1 o'clock is my understanding. So I'm having a lot of fun. So I hope everybody else is having a lot of fun too. As you can tell, this is a topic I love to think about and talk about. And so let's keep going. I've heard that marijuana helps to reduce seizures. How much is this worth the treatment if marijuana develops psychosis or mental health problems? That's such a good question. So the marijuana that's been shown to reduce seizures is the part of marijuana called cannabidiol. So marijuana has over 70 types of cannabinoids in it. Cannabinoids are 21 carbon-containing molecules, of which tetrahydrocannabinol is one, and cannabidiol is another one. Cannabidiol is now a medicine sold in pharmacies like Walgreens and CVS under the name Epidiolex, and it's been FDA approved for seizures and a certain type of seizures, not all seizures. So I guess I would just recommend talking with one's doctor about that, because it might be helpful for some people. We know that very high THC products, such as synthetic THC, which binds to the marijuana receptor, the CB1 receptor in the brain very tightly, can actually cause seizures. So again, I would talk with a healthcare provider about that. Let's see here. When we notice those changes that you mentioned that signal substance abuse, what can we do? I talk to him about drugs and drinking all the time. He denies, and I have no proof, so maybe he isn't using anything. What action should I take? It's a great question. So if there is suspicion, I recommend, early intervention with a specialist. The most powerful thing, though, again, is that relationships. So I think I just want to affirm what this questioner is asking about. It sounds like you are being so responsive and involved in your child's life and trying to read their cues. And that right there is great. And that's a great start right there. If you have no proof, then so that sounds like you're doing everything you can be doing. Now, if there's something else going on, like decreased signs of depression or something like that, we know that depression rates are up 3 times. Depression rates right now in Colorado are 3 times normal. And we know that young people are disproportionately affected by natural disasters. So there could be something else going on, like depression or anxiety, something like that, made a lot worse by social isolation and the things that we're having. How do you respond to clients and or parents who believe marijuana use is therapeutic for teens with depression or anxiety? Yeah, every intervention for depression and anxiety and every medical intervention we have has pros and cons. So somebody gets chemotherapy for cancer, there's pros and there's cons to it. The pro is that it might cure the cancer, and the con is that it causes vomiting and you might lose your hair and things like that with chemotherapy. Same thing with all the different medicines we have. They have their pros and cons. And so marijuana can be a short-term treatment for depression and anxiety. We know that. I showed you the picture of the brain where there's all those receptors in the part of the brain important for emotions. We do not believe that marijuana is a medium or long-term treatment for depression or anxiety. And we know that the risk benefit is not good here, that the risk of addiction and the risk of psychosis and other issues is really significant. So I think that's the main thing. I would respond with lots of empathy about what a great parent, how they really want the best for their kid. And at the same time, there are pros and cons, and the cons are kind of serious. That's how I might respond. Would it be fair to say that parents and youth workers, et cetera, should prioritize finding and treating the root cause of why a person is using marijuana, just as much as they work to help a teen reduce use and start cessation? Yeah, I like that. Let's see here. I would say yes. I mean, in treatment, what we do is we connect people with who and what matters to them. We do a lot of work to try to connect people to their caregivers and promote that attachment. That's how we do that. And basically the thinking is trying to promote a better alternative life to substance use. Just reiterating that if we pay attention to the mental health alone, nothing will happen to the substance use. So we do have to kind of address both mental health and substance issues in somebody who is using substances. And yes, it's important to address the mental health. What are the statistics of the Hispanic teen population and substance use? I have a large Hispanic population at my high school. I want to be able to connect with them better and help them. I think that's a great question. So if we look at substance use rates by race and ethnicity, the Native American populations have high substance use, whether it's alcohol or marijuana, followed by white teenagers, followed by Hispanic and African American, then Asian teenagers. So that's, that's what the main finding is. And then what we've seen of concern here, though, with Hispanic populations is a significant increase in use recently over the last few years, kind of like catching up to the, I put that catching up in quotation marks, catching up to the white and Native American populations in terms of the amount of substance use. Anything specific? Yes, 70% of the patients we see here in the STEP program are Hispanic. And, I think that's one of the things that has led me to the whole concept of attachment and attachment to one's family and caregivers being such a powerful force to prevent and treat addiction. And we've analyzed our data upside down and sideways, looking for who responds to what different interventions, and we haven't found a difference between Hispanic youth and African American youth and white youth in terms of how they respond to different treatment and interventions.
Hi, everyone. We have like 5 minutes left and we still have a ton of awesome questions. So I just changed the Q&A so you can upvote and view other people's questions and maybe vote for the ones that you too want to be addressed within the next 5 minutes. Hopefully we're able to get to all of them because there's really great questions. I want to hear all the answers. Thank you.
Julie, you're awesome, and I love your tech savviness. This is so cool. So I'm looking through, I see a couple of votes for this question. Many youth and parents see a little marijuana and alcohol as a normal part of being a teen. How do you respond to that from a scientific standpoint? That's such a great question. Okay, a couple thoughts on that. Half of high school seniors have never used marijuana. So there is a myth out there that adolescents are going to use, so I might as well roll over and help them use and have their experience. So I just want to get that out there, that it still is normal to not use marijuana, for example, to make it all the way through high school with that. Number two, there's no known safe amount of marijuana, alcohol, tobacco use in adolescents. So the same reason we have pregnant women and we say there's no known safe amount of alcohol use in that population, or marijuana or tobacco use, we say that for the adolescent developing brain. I think extending it there also makes sense to me. Again, I would respond with lots of empathy, like, yeah, they just want the best for their kid. And they see this as a normal part of development, yet there are some concerns about that. All right, so the leader, do you consider video game addiction a substance abuse, or is it treatment for that completely different? Great question. Video gaming addiction lights up the very same brain reward pathways as substance use. And so that is moving into the space of compulsive addiction behavior. The treatments we have so far are highly similar to addiction treatments. One complexity is it's very difficult to not spend the rest of your life with a cell phone or access to a computer, whereas you can live the rest of your life without cocaine, for example. All right, next one, fear versus fact-based education of substances for children, and what age should honest conversation begin? It's another great question. I think it should be factual. Fear has been shown not to prevent substance use. So the scared straight model and all shown not to be helpful. I think the substance conversation should start early in elementary school. Drugs are bad. And then in middle school, drugs are bad because, then in high school, what do you think about drugs? Do you have friends who are using drugs? Have you ever been offered them? Have you ever used them? What are your experiences with them? So the conversation just changes over time, and it's not just one conversation, it's an ongoing conversation. So with that, Julie, do you want me to finish up with that, or Leah?
No, I was thinking we could share some of the responses in our follow-up email. I was just going to put it in the chat as well. We'll save all your questions, and when we send out the recording and the slides, we'll respond to those as best as we can. I'll put our contact info in the chat right now if anyone needs to reach out. But yeah, it's 1 o'clock, so would love to respect everyone's time and yours as well. This has been amazing and super informative, and I'm so glad we have so many questions in the chat. It's definitely needed in our community.
This was great. This was so much fun for me to do. I'd love to, if people found any value in this, I'd love to do this again. This was good, clean fun. Thank you.